4 o'clock. I was hoping just a little bit because I don't see either Jeff Earl or Brett Todd on the line yet. But I think we should get going, and if they're able to, they'll join us. I will mention to everybody that Ann Warren is unable to be here today, so she will not be attending the meeting. And with that calling to order, I'll then go to the traditional land acknowledgement statement, which reads as follows. These Grenville and Lanark are located on the traditional territories of Anishinaabeg, Huron-Wendat, Haudenosaunee, and Oneida, dating back countless generations. We would like to show our respect to Indigenous peoples for their contributions and recognize the role of treaty making in what is now Ontario. Hundreds of years after the first treaties were signed, they are still relevant today. So with that, I'm going to move then to our third item, which is approval agenda. Again, I've just assigned movers and seconders. If you prefer that you not be, just let me know and we'll change it. So for that, I have moved by Doug Struthers, seconded by Bill Dobson. The motion reads that agenda of the November 18, 2021 regular meeting be approved as circulated. So I'll ask our mover and seconder, is that satisfactory?
Yes, it is.
Yes.
And I think I'll just go by exception in the future. I'll just find out if anybody, just indicate if you do object. I see that Mayor Todd has joined us, so welcome. So I'll call the question. All in favor? No, is there anyone who objects to my declaring this motion carried? Motion carried. Thank you. We're then on to the next item, which is a consent agenda. Consent agenda. I have it moved by Cheryl Smith, seconded by Tony Circo. Motion reads that the following items on the consent agenda be approved as circulated. 5.1 is the minutes of the Board of Health regular meeting held on September 23rd, 2021. 5.2 is the general correspondence. 5.3 is the MOH CEO duty of care report. 5.4 governance insurance committee duty of care report. 5.5 report from the governance and quality assurance committee. And 5.6 is a report from the finance, audit, property and risk management committee. Before I open it, is there anybody who wants any of these subjects discussed separately? Go ahead, Doug Struthers.
Yes, thank you very much, Mr. Chair. I'd appreciate 5.5, the report of the governance and quality assurance committee.
All right. Then I'll pull that at one separately. I'll find out if we have approval of this of everything but 5.5, and then we'll go to 5.5. And I believe I understand why you're raising it, which is great. So is anybody any objection to my declaring the consent agenda except for 5.5 declared as carried? It is so declared. So then we'll go to 5.5, which is report from the Governance and Quality Assurance Committee. Just excuse me while I take a moment to dig that one out.
Yep.
And why don't you go ahead, Doug, with your comment on it?
Yeah, thank you very much, Mr. Chair. Yes, and it's specifically the section on Board of Health COVID-19 vaccine policy. And I think everybody would be reasonably familiar with it in the sense that we were all, the board members were all provided with a draft copy and the opportunity to comment on it, and which I did. And I'm not sure if everybody received the replies that I got back. One from you, Chairman Langton, and the other from Dr. Stewart. And my concern is the use of the, I wrote this down, the use of the word submit as opposed to provide proof of being double vaccinated. From my point of view, I have absolutely, sorry, first of all, I think it's a great idea, pardon me, the purpose, to ensure that we're all going to be staying healthy when we do get to meet in person again, not only the board members, but also staff members. We are in a workplace, I understand. We are, though, are not employees, and we have that I can't, I'm going to be careful here saying every member of the board has a legislative right to be here in the sense that we are appointed. So I have no problem at all providing verification, whether it's via the QR code, which I'm pleased to say I can do, or I can provide a screenshot, which again, I'm pleased to say I was able to do that by myself, or indeed provide a paper copy. So it's all fine and dandy. My concern is that there is not the need to collect and retain, I'm going to say, my medical information, my vaccine information. To me, it's not any different than, pardon me, a process than under the provincial guidelines, a restaurant that needs to see proof of my vaccines. They have a process that they can show that they went through the exercise, and every customer that came in verified they're being vaccinated. There isn't any reason that the health unit cannot do the same thing. The fact that the receptionist or the gatekeeper, whoever it's going to be, when I enter one of our buildings, doesn't have a QR reader, I'll be careful of my wording here. I'm not going to use the word spurious, but for heaven's sakes, it's not a huge expense to have that capability provided. Nonetheless, to repeat, I can show on my phone a screenshot or a paper copy, and it's just a matter of a process that the health team can have, that they are verifying anybody and everybody coming in to be vaccinated. I have a significant problem with anybody, let alone the health unit, retaining what I call my medical records in terms of having to submit my medical records. My suggestion is that we modify the wording in the policy, or provide a receptionist the capability of being able to do a QR code reading.
Okay, Doug.
Thank you, Mr. Chair.
Before I open to the rest of the members, I'll just say that perhaps I should have asked you what wording you would be substituting as an amendment to the policy. Now, recognizing that in terms of the report, it comes through the consent agenda and doesn't have a separate motion, but I think that you're looking at the third paragraph, which is Board of Health COVID-19 vaccine policy on page 1. And you're going to the second statement that says the policy states that all board health members must be fully COVID-19 vaccinated to attend in-person board meetings or to meet with employees in person, and that the board members will submit their vaccine record to human resources before attending. Did you have a proposed wording change that you would go? And I'll just simply declare that being the amendment. And if it's adopted by council, then Heather will ensure that the policy gets changed accordingly.
Yeah. Again, I want to underscore the fact that I certainly agree with the purpose of the policy. Mm-hmm. It's that section, and you think you captured it correctly, will submit their vaccine record. And boy, I wasn't prepared to provide a wording. If you give me a moment, I may be able to stumble in good wording. Members will verify their vaccine record before entering in person.
All right, I think members, unless I'm incorrect, please express it if I'm not. I think we have the gist of what Doug is proposing here as an amendment to the policy. So I'm going to open it up for discussion in terms of our members here to decide to arrive at a consensus as to what wording we think that it should say. So it really is versus submitting your documents as opposed to confirming them. Does anybody second and support the motion that has been presented here? Okay, it's seconded by Bill. Do you wish to speak to it, Bill?
No, I think it's been covered quite adequately. Thanks.
Okay, is there anybody else that would like to comment on it?
So Doug, it's Paula. Doug, I got kicked out of the Zoom meeting, so I'm calling in by phone.
Oh, okay.
Yeah. So I'm not sure exactly what that means. Is it that you're just attesting verbally to say you've been fully vaccinated? So
If
what,
I-
what
if I-
does that
if I
exact
could-
mean?
if I
I'm
could,
gonna pass it to Doug. He has the amendment here.
yeah, if I might, Mr. Chair, do we need to have this passed today? And perhaps with the conversation we've had, we put it back either to staff or the committee to get some appropriate wording, I guess, to capture, what I said and perhaps what Paul's concern is. I'm not sure how wordy we want to get today in getting something in it. I've just put that out there that if there isn't, if given that we're not meeting in person in the near horizon, we do have some time to have some wording that captures everything. In other words, members will provide verification. I don't know whether you want to put in with the QR code, with the screenshot, with a paper copy. Maybe it might be with appropriate documentation.
All right, Dr. Stewart, essentially based on your comment, I think Doug is amending his amendment at the moment to defer the issue. Is there a time concern with regard to this item if we were to defer it?
No, and in fact, we've got the governance committee meeting on December the 3rd, so we could take it back there, Doug.
So the seconder to the motion, Mr. Bill Dobson, would you accept, well, I go to Doug first. Doug, do you accept then that as the amendment in a sense? To defer
Yep.
the item instead of the direct one? Okay,
Yes, we'll defer. Absolutely. Yeah.
okay. Bill, do you support that? Second that?
I do. Just a couple of comments. I think that Paula's comment was just that to clarify that we're actually saying to verify, not submit. I think that's the gist of it. So I just wanted to say that, but yes, I'm in favor of deferring this, but I also want to mention just, I saw Peter's hand a few minutes ago. Maybe we should hear from Peter before we actually finalize this.
Yeah, absolutely. Peter, go ahead, please.
Yeah, I'll defer my comments till I'm on that committee, so I'll defer those. That's fine.
All right, then. If there's no other member that wants to speak to it, I'll simply say, is there a consensus to defer this item to the next to the next governance meeting? In this case, just speak up if you have an objection to that. Otherwise, I'll regard that as being the motion that is carried. All right, that motion to defer is carried then. So we'll move on.
Thank you very much. Thank you, Mr. Chair.
Great. All right, that takes us to item 6, which is presentation by John Cunningham, Kim McCann, Joe Reed. Subject is radon. And so I'll just invite whoever's going to take the lead to go ahead and make the presentation.
Hi there, this is Joe. I can take the lead.
All right.
Heather, thank you, or Paul. Paul, are you controlling these slides? That's great. Okay, so yeah, again, thank you everyone for having us. My name is Joe Reed. I'm a health promotion consultant with the health unit, and John Cunningham, our epidemiologist, will be presenting a few slides here too. So with that being said, we'll get right into it. Next slide, please, Paul. So just a quick overview here. We're going to talk briefly about what radon is. We're going to talk about the health unit's radon public awareness program. And then we'll talk about ongoing radon awareness within the health unit region. Next slide, please, Paul. So first, what is radon? Well, it's a naturally occurring radioactive, colorless, odorless, and tasteless gas. And it's found everywhere in the Earth's crust. As a result, radon gas can be found at some level in all homes across Canada. And that graphic you see at the bottom of this slide, it just kind of shows how radon can get into our homes. So basically any crack, hole, a crack in your foundation or the sump pump, radon gas can seep into our homes, basically in any area where your home is touching the ground. Next slide, please, Paul. Health effects of radon. We know that radon causes lung cancer. It's the second leading cause of lung cancer overall, behind smoking. And it's the leading cause of lung cancer in people who do not smoke. So in Ontario, just less than 14% of lung cancer deaths are caused by radon. So that's about 850 lung cancer deaths each year due to radon in Ontario. And the risk of developing lung cancer due to exposure to radon, increases with 3 factors. So number 1, the level of radon. So the higher the level, the higher the risk. Number 2, the period of exposure. So being exposed over a long time period increases your risk, and concurrent smoking. So if you smoke and you're exposed to high levels of radon over a long period, your risk for lung cancer is increased. Next slide, please, Paul. Why test for radon, and why are we talking about it today? So a 2012 study by Health Canada found that approximately 7% of homes in Canada had radon levels higher than 200 becquerels per cubic meter. So that 200 level is that's a threshold set by Health Canada as a guide for what's unhealthy. Basically, anything above 200, Health Canada recommends doing something to lower that level, but there is really no safe level. So from that same study, about 5% of homes tested in Ontario had results above that 200 becquerel per cubic meter threshold. And in LGL, that number was 19% of homes tested. So pretty high relative to the average area in Ontario. A couple caveats to that study. There were a relatively small number of homes tested, so it's difficult to know the true prevalence. So this data from Health Canada, along with the fact that radon awareness was added to the Ontario Public Health Standards, spurred us on to investigate how radon is distributed in the LGL region. Next slide, please, Paul. So that's what led us to our own radon public awareness program. So from November 2019 to March 2021, Health Canada granted our health unit $25,000 to promote radon awareness. And with that, our 2 main goals were to, number 1, increase awareness of the health risks of radon in a person's home. And number 2, increase the number of LGL homeowners who are testing for radon and engaging in radon mitigation if it was required. So what did we do with that 25 grand? We bought several hundred test kits and we distributed them for free or at cost to homeowners within the LGL region. And the pandemic, it didn't make things easier. So one fairly large cost when things were shut down was that we paid to mail kits to different homeowners. We also hosted in-person education sessions. Those were in Carleton Place, Brockville, Sealy's Bay, Gananoque, and Smiths Falls. We paid for Facebook ads and newspaper ads, and also for staff time and travel expenses. So with all those radon test kits that we distributed to homeowners, we received the results for all those test kits that were submitted by the homeowners, and we've analyzed that data, and John will speak to that in the next few slides.
Hi, good afternoon, everyone. Could we have the next slide, please? Okay, so just going over the data very quickly. Talking about the study that Joe just outlined, we had 452 radon tests returned from the public and were analyzed. Now, I've got to say that we have 35 tests outstanding that we still have to analyze to add to that total. And we have another 50 tests that are being run concurrently. So, you know, we could potentially have a total of close to 540 tests when all is said and done, which is a decent sample size when you consider that the Health Canada test for LGL was only based on 108 samples. So given the data that we've analyzed so far, 88 or about 20% of the tests completed were above the Health Canada acceptable limit for radon within the home of 200 becquerels per cubic meter. And 12 of those tests, or 3%, came back, were above the 600 becquerel per cubic meter, which is a very critical level. Next slide, please. The data from LGL, interestingly enough, was very similar to the 2012 Health Canada study. As Joe mentioned, about 19 or 20% of our tests came back above the acceptable limit of radon within our homes. And that, by the way, is the highest rate in Ontario. Radon levels were much higher compared to Ontario overall at about 7 or 8%, and compared to Canada overall at about 7%. So quite a difference statistically between our region and other regions geographically. We don't really have enough data to make conclusions regarding patterns of radon distribution in our area, just enough to make overall statements about levels of radon in our area. One of the emergent goals that have come out of the data is to produce a risk gradient map so that we can see areas specific to our area that are showing higher levels of radon relative to others. The team also did a pre and post test questionnaire to evaluate the work that they did, their education work. And the results of that were that 3 of the 4 questions around radon awareness, reduction techniques, and testing indicated a statistically significant increase in improvement or understanding by participants about knowledge of radon in their home. And the only question that did not show any improvement already had a very high level of public understanding. So it was very encouraging. Next slide, please. So as I said, one of the goals, emerging goals of this study is to produce a risk rating map. And you can see the map on the left here doesn't really give a very fine level of risk gradient. The square box is approximately where LGL is, and you can say it's not very granular. So we're hoping to collect enough samples over time to give a more complete local picture and to create a risk distribution surface. And that would be something like the map on the right that actually shows the points geographically located on our map with the radon test results incorporated in. Once we get a sufficient amount of points spread across our area, we'll be able to create a continuous risk surface to show areas that have a higher risk of radon, therefore potential health influences in our area. And that's all I've got, Joe. Next slide, please.
Thanks, John. So I'll talk briefly about how to reduce radon in your home. So radon mitigation methods are available and effective, and a radon mitigation professional who's certified by the Canadian National Radon Proficiency Program, or CNRP, can be hired. And we've provided resources to the public on how they can do this. And there's 2 of them, cnrp.ca and takeactiononradon.ca. Next slide, please, Paul. So ongoing radon work within our region. So this fall and winter, we've continued to sell kits at cost. That's for $20. We've already sold out of our first batch, and we just started at the beginning of November. We've ordered more, and they're on the way. Additionally, November is Radon Action Month. So fall and winter is the best time to test your home for radon because our homes are more tightly sealed up due to the cold weather. So Health Canada and other health organizations like ours generally put a push on for these radon testing initiatives starting in November every year. And we've done this again this year, again, by selling kits at cost and with different things like social media posts and different radio interviews. And then the 100 Radon Test Kit Challenge. So this is an initiative. It's put on every year by a group called Take Action on Radon. That's a national organization that's funded by Health Canada. And they bring together radon stakeholders and they raise awareness about radon across Canada. So municipalities can apply to be a part of this program. And if they're successful, they get 100 free radon test kits that they can distribute to their residents. So locally, North Grenville did this in 2019. Leeds and the Thousand Islands did this in 2020. Front of Young is doing it right now. And Carleton Place has expressed interest in doing it next year. And then the next one, the library lending program is fairly new. So libraries can either do this on their own or they can apply to Health Canada for funding. And right now, Mississippi Mills, and Gananoque, their libraries have purchased digital multi-use short-term radon kits, and they're lending them out to residents. So residents can take that home for a week or so and get a measure of radon in their home. And that's free, obviously, from the library. If that digital test spits out a high number, then the library recommends to them to use a more reliable long-term single-use kit. And those are the ones that we've distributed currently and in the past to residents. And so we've offered 5 free kits right now to those 2 libraries, and we're just waiting to hear back. And then again, Carleton Place Library, they're thinking about doing the same thing, and we've already got 5 free kits to them. Next slide, please, Paul. That's about it. Thank you all for your time, and we're happy to take any questions.
All right, maybe there, that's perfect. See, Bill, you have a question? Anyone else? See you joined us, Jeff. Welcome. Okay, go ahead, Bill.
Yeah, thank you. Thanks for this great report. I guess 2 or 3 things. I'm just wondering, and sort of wondering out loud, would the reason why this area might be more susceptible to this than would it be because, number one, because there's probably more older homes? I'm just wondering about that than in other parts of Ontario. And the other part is I'm wondering about, because we have very shallow rock in a big part of our area, and we have like the fractured rock. So I'm wondering if that might be a reason. And the other thing I wanted to ask about was, do you know if young people, children, are more affected by radon than older people? And if so, then my concern would be, what kind of work have we done in the schools? You're talking about a lot of work that we've done in homes, but what about schools? So sorry about all the questions, but those are my comments and questions. Thanks.
So whoever wants to take that, go ahead. And if it's a multiple, please proceed.
Sure.
I can jump in on some of that, Joe, if you don't mind.
Yeah, go ahead, John.
To start off, radon distribution is basically based on Canadian shield rock being exposed to glaciation thousands of years ago, and the naturally occurring uranium and radon, which is an isotope of uranium, would have gotten scraped off this rock by the ice and then deposited where the glaciation ended. And the St. Lawrence River lowlands along the Great Lakes is one of these areas where a lot of this glacial deposit occurred. So a lot of this radioactive material has been concentrated there. That's one of the reasons. Another reason you cited about our exposure to shield rock is very true. It occurs naturally in shield rock. So that's one of the reasons our area has a higher concentration. When it comes to, Dr. Stewart, you can jump in on this as well. It comes to younger people. I mean, exposure to ionizing radiation is a cumulative thing, so it does damage to your DNA over time. So it's probably more related to age than it is to younger age, but any exposure to this is not good exposure.
Yeah, it's John is right, and the thing is that if you're it's exposed for a long duration, and so if you're exposed as a child and then you have the radon daughters that are sitting in your lung and are making changes, and then because the radon daughters disappear but the changes are there, and then over time those changes can turn into cancer. So if you're exposed when you're younger, then you've got more time when you've had damage to your lung cells, which then increases your risk. So absolutely, that children are really a really important group to consider.
And
about the schools.
we had at the very beginning of this, we talked about going to the schools, and then COVID hit, and schools have been really, really busy. I think once things settle down a little bit, we would like tests to be done in schools for sure. And then it's a conversation with each of the boards to see whether they'd be interested in doing that. So I think that that is definitely something that we're still thinking about, right, Joe?
Yeah, absolutely, Paula. And we did kind of same idea with daycares. Once COVID hit, they were already overwhelmed. We did send them a letter this year, I think earlier this year, just to get the ball rolling and make them aware of it. But we were a bit cognizant of putting too much on their plate because obviously relatively COVID is a bigger deal right now than Radon. And Mr. Dobson, I'll just speak to your question about older homes too. That's not necessarily a factor. Levels can be high in a new home, old home, whether there's a basement or no basement, or whether there's exposed rock or dirt even right in the basement. And in some cases, because newer homes are even sealed more tightly generally than older homes, the radon level could be higher in newer homes, but we don't have the data to say for sure one way or another. So we continue our message is the only way to know really is to test, and that's our message.
Thank you.
Thank you. Is Kim, did you have anything you wanted to add? I haven't heard from you.
I don't think Kim's on.
Okay, that's great. I wasn't sure if it was an issue of muting or not. A question I have is that I bought a kit late 2019, and I thought it was too late to get it done because it said the best time is when the house is sealed in winter. And then I forgot about it in the following year and bumped into it just shortly. Is that kit still usable?
So it should have an expiration date on it. So just check if it's on there, and that should tell you. Yeah, and then once you put it in place, it can be in place at minimum 91 days and up to 12 months, and then you can mail it into the lab.
Great, thank you so much. Before we move on, is there any last question from anybody? I'm seeing none. I'm going to take us an agenda to item 7, new business, which is Finance, Audit, Property and Risk Management Committee report. It has 3 motions in it. 7.11, 2022 public health budget, 7.1.2 review of board stipends, 7.1.3 Board of Health budget. Now, it's indicated on the agenda that Bill, you're going to lead. Is that the way we're proceeding, or is it Chair Tony? No? Okay, I'm seeing, okay, Bill. What I can do is read out the motion for each of them, and then I'll let you have a chance to speak to it if you wish to, or open it up to questions. So for 7.1.1, the motion reads as follows. Moved by Cheryl Smith, seconded by Brett Todd, that Board of Health approve the following. 2022 General Public Health Programs budget of $13,923.76, consisting of $13,596,615 for the Ontario Public Health Standards and $327,131 for other programs and services. Also, a 2% increase to the 2022 municipal levy to offset the general public health budget shortfall. Third point, submit a proposal for 2022 one-time OPHS and COVID-19 expenses based on Ministry of Health guidelines. The fourth bullet is retain the 2022 Provincial Municipal Mitigation Fund for obligated municipalities until the 2022 COVID one-time provincial funding is received. And finally, request that the obligated municipalities loan the 2021 provincial municipal mitigation funding back to the health unit in January 2022 to provide adequate cash flow until the one-time COVID-19 funding is received from the province. So either Bill or Dr. Stewart, did you want to speak to it, the motion?
I think
Bill, do
I
you want
can,
me to speak to it? Or you
yes,
go ahead,
that's
Bill.
great.
You want me to speak
No,
for
you
it?
go
Okay.
ahead, Paul.
So within the budget, you'll notice that our budget shortfall to be able to fund all of our existing public health staff, not the new COVID ones, but the new ones, that we have not had an increase in the provincial grant for the last 3 years and have been told we will not get an increase to our base funding. And so our budget shortfall has climbed year after year after year, and it's now up to 933,000 and a bit. And so we're going to manage that this year through our usual gapping and people going on using LOAs and delaying filling positions and so on. And then we are expecting to get one-time funding from the province, and so we'll be able to move those people over into that funding. It would really, really help us if we could have a small increase from the municipal levy, which will allow us to sort of 61,000, which would allow us to make a little dent in that budget shortfall. That's basically 3/4 of a public health inspector or a nurse. So that's why the finance committee looked at it carefully and is recommending that we have that small increase in the municipal levy, and spread across all of the municipalities is not very much for each one, but together it adds up to something that could really make a difference to us. So that's the first part of it. And then last year, the board decided that we have to make sure that we have enough cash flow to be able to hire the additional people for the COVID vaccine program and the COVID general program. And eventually we got the money, but not till August. And so last year, the municipalities agreed that we could take the 2022 mitigation funding and just keep it until we get the money, and then we give it to the municipalities. The same thing with the 2021 mitigation funding, which we're about to give to municipalities, that we borrow it back in January just until we get the money in later in the year. So we'd like to do the same thing this year, because that really made a big difference to us being able to actually pay people. Happy to answer any questions.
All right, are there questions? Okay, I'm not seeing any, and so I will ask if anybody objects to my declaring that motion carried. And seeing none, I declare the motion carried. That moves us to then item 7.1.2, review of board stipends. I have the motion moved by Bill Dobson, seconded by Peter McKenna. The motion reads that board member stipend remained the same at $90.71 per meeting for 2022. Again, is it Paula or Bill that will speak to this if there's a necessity?
I'll let Bill.
Okay,
Yeah,
go
no,
ahead, Bill.
I don't need to speak to it. I'm fully in favor of it, especially for this year. So I'm fully in favor of it.
Yeah, and the motion's fairly straightforward. Is there anybody that has any comments, questions with regard to it? I'm seeing none. Does anybody object to my declaring this motion carried? On that basis, I declare the motion carried. We're moving to 7.1.3, Board of Health Budget. It is moved by Tony Circo, seconded by Doug Struthers. Motion reads that the 2022 Board of Health budget in the amount of $22,750 be approved as circulated. Does anybody wish to comment on that, or anybody wish to question? Again, I'm seeing none, so I'm going to ask, does anybody object to my declaring this motion carried? Seeing no objection, I can declare this motion carried. That takes us then to 8, which is an in-camera session. I have a motion for moving to in-camera. To move by, and I'm going to verify because I don't see Mayor Todd on the line. Oh, I see Doug Struthers is. Doug, you're muted. You're muted.
Muted.
My apologies.
$25.
Well, I thought Jeff Rose said it was 20, but anyway. Maybe it's inflation. Mr. Chair, I think you jumped over 7.2 on our agenda.
Oh, thank you so much. Probably should have kicked me there sort of symbolically in some way.
You can cover my mute penalty.
It's a little, thank you for that. It's a little item squeezed between two big ones. So yes,
There you go.
excuse me very much, Dr. Stewart, your MOH update. Please go ahead.
Okay, thank you. I was trying to decide if you really didn't want it. I mean, it goes in the minutes anyways, and so I'm prepared to keep on going. Okay, so if you've been following our surveillance report that John prepares very well each weekday, we've definitely seen a surge in the number of new infections. Our active infections are up in the high 30s now, and 2 weeks ago they were down in the teens. And what we were seeing is that more infections among people who traveled elsewhere or who have visitors who are from other parts of the country or even the world and coming back here. So that's part of it. We're seeing spread within people who have mild symptoms and they go out anyways because it's not one of the big five: the fever and chills, the loss of taste and smell, the cough, the shortness of breath, the fatigue. And then when they develop, then they pull back, but they've already exposed some people. And then we're seeing when that happens spread within the household. So so far, I think there's only maybe one or two where people don't know exactly where they got COVID from, which is good in a way, in that we're not seeing widespread sort of diffuse spread of the virus. It's very focused on particular people who have had particular exposures. So our staff are very, very busy following up on all the cases and the high-risk contacts. We did have our first serious outbreak in an elementary school and have been really, really working hard with the school and the school board to manage that. And what we're finding is it's when kids don't have their masks on, so that sitting in a pod at lunchtime, playing with their friends, that's when we're starting to see spread. We had fantastic support by Lanark County paramedics to go and do testing of over 200 kids in the school on a Sunday, and the parents brought the kids out. So there've been really, really a great cooperation, and we're hoping that, touch wood, things will settle down now. We've had a few outbreaks in businesses, but only one where it spread beyond one person. So that means that we're following precautions pretty well. And I think it's just, we have to recognize that the virus spreads more easily now because it's cooler weather, drier weather, and the droplets that leave our nose and our throat full of moisture, the moisture actually gets taken up by the air, and then it's a smaller droplet that can stay in the air a little bit longer. So working hard on media with that. And as Doug Struthers keeps saying, we got to keep following those precautions. I keep talking about layering precautions. And the first one is not going out when you're sick. And we're suggesting that if people have a mild headache or that scratchy throat or just not feeling well, don't go out. Wait and see if the other COVID symptoms develop. I mean, even if you don't have COVID, you don't want to spread what you have. And then wearing the mask is so critical when you're out in public places, and really encouraging people to think, as we're starting to get into the Christmas season, about having a conversation with the people that you're going to be meeting with. And is anyone there who could really be have a serious COVID infection, even if they're fully vaccinated, and really have a conversation with people so that, and people talk about what risk they might have had and so on. So I think it's really being transparent and open with people as you're making decisions. Really pleased that we now have the updated data from Stats Canada on our actual population. I think John's been waiting for this for a good year, probably. And so that it means that our vaccine numbers have gone down a little bit. Still in the 80s, still really high. And our population has increased because the horseshoe area around Ottawa of our region, so North Grenville, Almont, Mississippi, Carleton Place, Beckwith, we've seen an increase in families coming in there, so people in their 30s, people under the age of 20. So our denominator has increased of the people who we want to be vaccinated, which has just lowered our numbers a tiny bit. But we're still at 94.3% have had 2 doses and 91.8% have 2 doses. So still really, really, really good coverage. Working hard on the 3rd dose booster, particularly for the 70+. Cheryl's on our Ontario team meeting that meets every Tuesday, and they talked about, we're not sure whether the 70s are getting the message. So Cheryl worked with us on creating a poster that can go up in various sites, and I sent it to all the municipalities. So if you could put that poster up in your offices and places where people will see it, that will help get the 70s in, because the data from the science table is that the vaccine starts to wane a little bit, instead of up in the 90s, more into the 80, 75% protection against symptoms in that group. So we are really keen on getting that group immunized. And there's been a lot of concern about when is it? When is 6 months? When is 168 days? So our team has made a great vaccine checker. So you only have to, it's on the website, you only have to put in your last dose and it will tell you exactly when your next dose is due if you're 70+. We are just eagerly anticipating the vaccine for the 5 to 11-year-olds. We've got plans for each of the fixed clinics, so they'll be more kid friendly, and the community clinics, primary care is involved with our planning. We're sending a letter home to parents through the school boards to help parents have the conversation with their kids, and also the list of what kind of places they can be going so they can choose a place that's appropriate for their child. So we're hoping end of November that we'll be able to start that vaccine. And having had that experience in elementary school where several kids became sick, I am so keen to get that group immunized so they can stay in school. That's our experience in the high schools. There may be one case, but it doesn't spread. Really pleased that the preschool speech and language program is now going to start having more in-person treatment. The virtual has worked well with some, and they'll continue that with some, but they really want to be able to offer the in-person. So we're going to start doing a little bit more of that. And Joe mentioned the Radon, so I don't have to mention it.
That's great. Thank you very much. And again, I apologize for that glitch. And thank you, Doug, for pointing it out.
You're
Does
welcome.
anybody have any comments or questions for Dr. Stewart based on our report? Go ahead, Bill.
Yeah, I just wanted to quickly mention that I was following up on the Kingston Frontenac clinics in Addington area today. And as of today, they're the worst that they've been in, I believe, some time away back in September. So they're the highest that they've been in 2 or 3 months. So that's them being our neighbor, we have to be pretty careful of them or that area too. So just wanted to comment on that. Thanks.
Yeah, and we're definitely getting some cases, and again, in Aquay area, which are spilling over from Kingston. And I think that if people, if you do need to go to Kingston, just be very, very careful. Make sure that you're really well-fitted mask. Make sure you keep the distance apart from people. Their situation is they don't know where a lot of the people became infected, which is why they're so concerned, and actually put out a media release this week about it. So yeah, you just gotta be really careful.
So sorry,
ahead.
Mr. Chair. One more thing I did notice that even though their cases are rising, and as I said, they're the highest they've been in almost 3 months, they're still, I did read that they're not willing to lax the regulations or restrictions any yet. So you kind of start wondering, like, at what point does that actually happen, or should it happen? And I suppose every health unit is different, but if you're the highest in 2 or 3 months and you're still not doing anything for the restrictions, I'm just kind of concerned about that.
Yeah, so I can tell you what I do. So each night I actually review all the cases that we have in our database. And I look to see whether there's a pattern. And you remember before, we've had situations like we had the really serious outbreak in Perth Smith Falls that was related to the curling club. And in that situation, then I impose more restrictions. So I am looking at it every night to see if there's a pattern, if there's something that I need to be doing to help to protect people. I can't speak for Kingston, but know that I am watching that all the time.
Thank you very much. Anyone else? All right, again, thank you for the report. Certainly didn't want to miss it. Moving to 8 then, which is the in-camera. I've suggested as movers, Brett Todd. I just verified that Brett is there. I don't see his. Brett, are you there? Oh, there you are. Thanks. Brett, are you okay with moving the motion? And thank you. Seconded by Cheryl Smith. The motion reads that this board moving to a closed session of the Board of Health due to the following, which is D, labor relations or employee negotiations, and G, a matter in respect of which a board or committee may hold a closed meeting. So does anybody object to my declaring this motion carried? I hereby declare it as carried. And so we'll just pause for a moment until we have people have left the Zoom meeting that will not participate in this. Zoom.
So Nancy Carpenter and Ben McNeil and Teresa Clow and Jane Lister are going to stay with us.
Okay.